Sorry that we are late today. I know we are, a few minutes late, but we had some technical difficulties. I am Diane Marseglia, Chair of the Bucks County Commissioners. I am joined today by my colleagues, Commissioner Bob Harvey and Commissioner Jean DiGirolamo. Wanted to welcome you all. I will pass it off for a quick hello from everybody today. One of the things that we were hoping to focus on today that I just want to share is that we want to think about moving to yellow now. Now, we don't have that approval or anything, but we know that's the next step. We know things are looking positive. So we want to be able to talk about how do you do that? How do you move to yellow? How are we going to keep everybody safe? So before I pass it off, the one thing I want to say about keeping things safe, I can't find my mask. Here it is. But you need to get a mask on. I have noticed as people are getting increasingly frustrated with this and tired, and I know that it hasn't been easy. I'm getting emails from people telling me that they don't want to wear a mask. They're not going to wear a mask. It doesn't work. That's not true. That's fake news. The masks do work. They protect other people from you, and they might protect you if there's germs out there. It's really important that you wear them, because if for some reason our numbers go up, we could lose that yellow. So please, please, please use PPE. And I'll pass it to Commissioner Harvey.
Thank you, Commissioner Marseglia. I think it's good advice you started off with. We hear a lot of the vocabulary about, when are we going to open Bucks County? And that's not really it's not really an accurate term to use. Open, I think, implies that we're back to normal, back to the way things were in February and January. That's not where we're going to be moving when we move to yellow. A lot of businesses will be able to open, but they will have to follow CDC guidelines, health department guidelines, and all of the things that, the social distancing and all those measures which are really necessary for keeping everybody safe. At some point when we go to green, that'll be more what we think of as open. But again, as Commissioner Marseglia said, moving to yellow is something that, could end up resulting in a lot more cases if people don't follow the basic guidelines. We still have to be washing our hands. We still have to be using a lot of hand sanitizer. If you're using rubber gloves, that's fine, but just be very, very conscious of cross-contamination. A lot of people use rubber gloves and they kind of think that it's sort of protecting them, and then they kind of lose track of everything they're touching with those rubber gloves on. And then they pick up their phone, or they scratch their eye, or they do something, and you just defeated the purpose of wearing the rubber gloves. So in a lot of ways, the hand sanitizer is actually better. But we're going to have to keep doing that. We're going to have to keep resisting touching our face, which it seems to be, for me, the hardest part personally. But I think that's true for a lot of people. And we're going to have to be very conscious of all the surfaces we're touching and trying not to touch as many surfaces when you're out in public. And that's all of those things are going to be necessary to really eventually push this virus out of our lives, which all of us want to do very, very badly. So I just want to ask people to keep all that in mind, and I'll turn it over to Commissioner DiGirolamo.
Yeah, thank you, Bob, and good morning, everyone. Thanks for joining us today. Just to reiterate what has already been said by both of my fellow commissioners, keep up the good work. I think it's really important. We are making progress here in Bucks County. From our situation report yesterday, there were only 24 new positive cases in Bucks County yesterday. And that's the lowest number that it's been in a while. So, keep up the good work. We want to keep it low like that. And the less number of positive cases that we have here in the county, the sooner that we will get to the yellow phase as determined by the governor and the administration. And I think that we are close to being able to get there. So we've got to keep that good work of wearing masks, practice the social distancing, staying at home. If you don't have to go out, that is also very, very important. So just keep up the good work. We're going to get there, and we're going to get there together. Thank you.
Thank you. So we will begin with the first question, and I have a yellow jacket on to keep us in the positive energy towards that today. But our first question is from Sonia Elmore from Bristol. She said she's thanking us for everything we're doing, but she owns a wedding venue in Bristol Township and would like to know if there will be any guidelines coming from the Department of Health specifically addressing event venues and banquet halls, as opposed to restaurants and bars when we start to open up. My understanding is that there will be guidelines. I think there are some guidelines out there. As far as a wedding venue, they are going to be thought of similar to a restaurant. So until restaurants are opened up, unless you're doing small weddings of 10 or 25 people, or you do them outside and you can space everybody apart 6 feet apart, I don't think that's going to happen for a little bit, but you could have people come in and look at your venue for weddings in the future, and I'm hoping there's going to be a lot of them. Bob or Jean, different answer to that?
Go ahead, Bob. Or
No, go ahead, Gene.
yeah, I mean, I think that like a wedding venue or a place like that where there are a lot of people that will congregate, and certainly for a wedding, if somebody's going to rent a venue, it's going to be more than 25 people. So you're probably talking about getting somewhere back to normal, where you have 100 or more people. I mean, I don't think that's going to be allowed till you get to the green phase. That's not going to be allowed in the yellow phase. And then again, I think even when we get to the green phase, that there might be some additional restrictions to being able to open up outside of, just being able to open up and put a couple hundred people in a venue. So I think you got a little bit longer to go. And, I want to make sure, again, and I keep saying this, the health, the safety, and the welfare of the people who live here in Bucks County are our number one concern. So I would just say have a little bit more patience. And when we get to the green phase, I think there'll be some more guidance on what you will be allowed to do.
Yeah, now, the only thing I would add is, businesses are having to get creative with how they conduct their businesses, and certainly that's been true here in this county in terms of how we've been trying to conduct business. But for wedding venues, certainly you wouldn't be able to have people in to the facility that you have. But if it's an outdoor space, that obviously opens up some possibilities. But catering of if someone wants to do wedding at their home and you're catering, that's certainly something that's no different than a restaurant doing takeout. So that's an option.
Thanks. The next question is from Dr. Suzanne Phillips, and she asks if we could comment on the number of days that Bucks County has qualified for the metrics needed, according to Governor Wolf, in order to change to the yellow phase. And has anyone asked Governor Wolf to expand upon the metrics needed to change to the green phase? The easiest one is the metrics for the green phase. We have not asked him. I don't think that they have come out with those metrics yet. So, we've been completely yellow focused. And so in terms of the question, how many days has Bucks County qualified? 0, as far as I can tell. And the metric that the governor put out required us to have, it's like 22 cases a day for 14 days. We may have hit that one day, come to think of it, one day where we hit under 22 or close to it, but we have to hit it for 14. So that means it could be a while to go. We have, as everybody knows, we wrote to Governor Wolf to talk about the metrics and have had some conversations about that. Bob?
Sorry. As you just said, we had some conversations. We continue to have conversations with the governor's office and the health department, and involving some of the counties around us as well, to talk about the metrics and making sure that the data that we have in this county, which from what we're learning is actually better than a lot of the counties around us, is something that is being looked at, making sure everybody has the right data. We're all looking at the same thing. It isn't even clear from the federal guidelines. It doesn't look as if we would be able to move to the next phase either. And I think in terms of moving to green, what you see happening now, I believe at the state levels, they're looking at all the counties who have gone yellow and monitoring them very, very closely to see, if there's any kind of spike in cases in any of those counties, and how, if so, why do they happen? How do they happen? Is there a way they can be identified and contained so that when other counties are going yellow, they know what kind of steps they can take? That's actually something we did. I reached out to one of the counties that turned yellow a few weeks ago, spoke to them last week to find out what are some of the things they've been encountering so that we can be as prepared as we can be.
Yeah, and just I'll just add on that, we have had conversations. I mean, we've had conversations with Dr. Levine. We've written a letter. We've had conversations not with the governor himself, but with people from his office in having a little flexibility when you look at these metrics for not only Bucks County, but the rest of the Southeast. And if you look at some of the counties that have been given permission to move the yellow, I mean, some of those counties have less than 100,000 people in them. I mean, some of them have as few as 50,000 people. So, when you look at Bucks County and we have almost 640,000 people that live here, I mean, it is a different situation and a different scenario that we have to go by to get to the metrics that are presently out there. So it is my hope that they are taking a look at these numbers, these metrics, this 22 a day, and realize that we have a lot more people in a lot smaller area than many of these other counties. And maybe to have a little flexibility with these numbers so that, that we can get to a point where we will be allowed to move into the yellow phase. And I would rather see that happen sooner rather than later. And again, I'm going to go back to yesterday, only 24 new cases yesterday that we had here in Bucks County. So I think we're making an awful lot of progress here in Bucks.
Thanks. So I'm going to give the first part of the next question, and then I'll read the second part and give it right to Commissioner DiGirolamo. This is from Lyle Kaminsky from Bensalem. And the first part of his question is that he's heard that community spread in Bucks County is going down and that hotspot nursing long-term care facilities and cases among healthcare workers in the community are also decreasing. That's true. That's the good news. Everything is going down. Our pure community spread was 0 a week ago Sunday. Since then, I believe it's been 4 people and under. So community spread, we're doing a really good job with. I think, you look at those numbers and that's the positive news. And same thing with healthcare workers, all of that is decreasing. The second part of the question, and this goes to you, Gene, is because you're from Bensalem, my concern is the high number of cases in Bensalem and that many people who work in Bensalem travel back and forth to Philadelphia. Could you elaborate on situations of COVID-19 cases in Bensalem and why you feel it's safe for Bucks to move from red to yellow?
Yeah, thank you for the question, Lyle. And, I think most of you know, I live in Bensalem as well. So, I keep a close watch on the number of cases county-wise. And I also, not only just in Bensalem, but I'd like to take a look at also the number of cases in the municipalities. And, I think it's really interesting that, of course, that Bensalem is the largest municipality in the county. We have approximately 65,000 people that live in Bensalem. And then when you look at the population of the county, which is 640,000 people, so roughly Bensalem is about 10% of the population of Bucks County. And when I looked at the totals recently, like over the weekend, for the number of positive cases in the county, it was approximately 4,300 for the whole county of Bucks. And the number of cases in Bensalem was around the 425. So if you look at that 425 compared to the 4,300, it's just about 10% of the number of positive cases have been recorded in Bensalem. So I don't think Bensalem has a larger number than the rest of the county by evidence with the numbers. So, I think the local municipality has done a good job making sure that everybody is doing what they're supposed to be doing. So I would just encourage everybody, whether it's in Bensalem or the rest of the county, to just keep up the good work. And, we don't have any larger number of cases here in Bensalem than for the rest of the county as a whole.
Thanks, Bob. Any comment on that?
If I could, I thought that was really a perfect answer. It just makes sense. The bigger municipalities, the more people you have, the higher the number of cases you're going to have in terms of raw numbers. But in terms of percentages, In some cases, we're seeing municipalities, Middletown, Bristol Township, for example, that have a lot of long-term care facilities, and so that's making the numbers in those specific municipalities a little higher. But they're also, the second and third biggest municipalities, in the county. So it does make sense that they're going to have just raw numbers be higher. But I kind of wanted to, if I could, just combine a couple of questions here, because it's also talked about numbers. And as the questions come in, the new questions come in, and all the questions we see start moving. So I have to find them now again. Howard Shargle, I apologize if I mispronounced that, was asking about the numbers that move us to yellow and how we're tracking. And also Shanna Grubb, or it might be Grube, I apologize again. What are our hospitalization numbers, and asking about hospital beds. So we look at a lot of figures, a lot of numbers here, a lot of statistics. And as Commissioner Marseglia and Commissioner DiGirolamo said, the numbers are all moving in good directions overall over the past week or so. With hospitalization, what we look at are regular medical beds available and ICU beds available. We look at ventilators available, and we also look at hospital staff absenteeism. We want to find out what those numbers are for all of that. In terms of hospital beds between the two ICU and medical surgical beds, we have had, and it's been pretty consistent over the past week and a half, 2 weeks, between 40 and 50% of those beds are available. They're open. In terms of ventilators, we've always had, I think the highest number of ventilators that were in use was about 30 of the ventilators that make them, have to go on a ventilator. So those are those numbers. For Mr. Shargle's asking about exact numbers, if you break it down, it's basically 22 new cases a day. Our health department every day will get test results from the different private labs, from hospitals, sometimes from the coroner's office. They'll get test results back, and then they'll start calculating all those test results and figure out, start making contact with all those people. Someone did ask about contact tracing and tests, so that kind of, I figured who that is. I saw that somewhere now. Yeah, somewhere, oh, here it was Nancy Rugel of Pipersville, asked about tests and contact tracing. We have always done contact tracing. We're the only county in southeastern PA that's been doing it at a very, very deep level, talking with, I think it's 95% of all the cases, finding out about their symptoms, when they started, who the people are, who the people they come into contact with, if they're going to work, who's in their home, other people they may have been in contact with, reaching out to those people. So we have that in place right now. We feel very comfortable with the team we have. We've already identified a plan that if we need to increase contact tracing, how to find staff to do that. In terms of tests, we've never had enough tests. This is a national problem. Certainly, we're relying on the hospitals who have some tests. We're relying on private labs that have tests. The county has never had enough tests. The counties we talk to have never had enough tests. It's one shortage or another. Either it's a shortage of the vial, it's a shortage of the swabs. We have tests that we use, but in terms of do we have enough tests, just the county itself, the county government, we don't. So but when you combine all of the tests available, hopefully we can use all of them to meet whatever metric we need to meet to have enough tests to make sure that we can have control of things when we go to yellow.
Okay, and then our next question is from Linda Notoris, and she has a question about why is the Pennsylvania Department of Health mandated that nursing homes accept contagious COVID residents back into their skilled unit after well-equipped and staffed hospital discharges the terminal patient? That's not true. Well, that is not exactly true. You cannot have a bunch of people in a hospital just taking up those beds that are needed by sick people. So when someone is well enough, if they came to the hospital, they were diagnosed with COVID, and now they're well enough to go back, our skilled our skilled nursing homes are trained in how to use personal protective equipment and how to take in people who might have droplet spread So that's not really a risk. It would be more of a risk if we continued to just let people sit in hospitals. Now, to make another point on that, most nursing homes haven't been accepting new patients during this period. So they're really just taking their own patients back. I will read one more part of this and then pass it on. And Linda is sharing that her mother recently passed away in a nursing home, and I imagine that must have been very, very tough. My mother's in a nursing home too, and it sounds like your mother passed from COVID, and I understand. She says it's heartbreaking because she couldn't be with her. This is probably the most difficult part of this, is people who've lost someone and they haven't been able to spend those last hours with her. But she is concerned about nursing homes being overlooked because of community, government, and possible greed issues, a lack of resources. She's worried they don't have enough staff, they don't have enough PPE, and wants us to make sure that we are protecting our seniors. Bob or Jean, do you want to take that part of the question?
Yeah. First, Linda, our hearts and prayers go out to you, on the passing of your mom, and certainly to every person, whether they're in a nursing home or not, that has passed away in Bucks County. I mean, our hearts and our prayers go out to you. It's just heartbreaking, and it's tragic. And I can assure you that we are working so hard here in Bucks County to make sure that all of our citizens, whether they're in a nursing home or not, are as safe and protected as they can possibly be. And again, this epidemic that we're facing, I mean, we've never had to deal with this before in our country. It's over 100 years that we had something like this. So we did not have any kind of playbook or anything to look back on to say, here's what we should be doing at the very beginning. So we are really doing our very, very best. And, I think all of the nursing homes, and we have a large number of them here in Bucks County, an awful lot, not only the skilled nursing homes, but the personal care homes. We have an awful lot of them here in Bucks County, and your county government is assisting them in any way that we can, whether if they need personal protection equipment. We have also gone into some of the nursing homes to help them out. We have given them staff. We are working with the state and helping them out. We are trying to assist them in any way that we possibly can. So again, my condolences on the passing of your mom, but everyone has our insurance that we're doing everything we can to help our nursing homes out and help our seniors out.
Bob, any comment on that?
No, I think Jean said it very well. Just to add on the two things. Number one, our health department director, Dr. Dansker, and Scott Forster, director of emergency management, they have regular communication, and they have for weeks and weeks and weeks now with the nursing homes and long-term care facilities to make sure they have what is needed. And there's constant communication between them. And so that's a very well established, connection. I just, we get a lot of questions about the long-term care facilities and steps that should have been taken and the assumption that steps weren't taken. And I think if we go back, 2 months or so, we've forgotten, things have moved so quickly, and we all have this sort of COVID brain now where we lose track of what day it is and what we knew yesterday and what we knew last week and what we knew 3 weeks ago. I think we've forgotten what it was that we didn't know 2 months ago. 2 months ago, the best experts were telling people across the world, not just here in Bucks County, that asymptomatic spread was really not something you had to worry too much about. That we weren't even sure people could spread it if they were asymptomatic. And so the best thing to do to protect nursing homes was to close all visitation, which we did very early here with the nursing home weed control, to take the temperatures of all the workers who were coming in, to restrict it to only the staff that needed to be there, to talk a lot and educate the workers, the employees, all of them about, if you feel sick at all, stay home. Here in this county, we made sure that we weren't disincentivizing people. You could just stay home. It's okay. If you feel sick, just stay home. And the thought was that by doing that and by wearing PPE and doing all those other kinds of things, that this virus could be kept out of nursing homes and long-term care facilities. And obviously we know now that it isn't the case. That a lot of people have this virus and are not symptomatic at all, that never have a fever. It doesn't matter if you take their temperature. Certainly that's a good step to try and screen some people, but a lot of people were spreading it anyway. They had no control over it. It wasn't their fault, and we're not blaming them. The first major news story about this virus in the United States was about a nursing home in Washington State, where the virus really, took many lives. It was tragic then and continues to be tragic. And the situation is a national one because these are the kind of facilities where the weakest of our loved ones and friends are living. And so this virus is not showing a lot of sympathy. That being said, we do have people who are recovering, who were in their 80s and 90s, and even people who are over 100 years old who have got this virus and recovered or are recovering as we speak. And so we're doing everything we can, as Mr. DiGirolamo said, and we're learning about this virus every day and taking that knowledge and applying it to make sure that we're keeping people as safe as we can.
Okay, so this is from Deborah Dubs, and I'm going to answer this question myself. She said her father passed away last year, and he had been in a long-term care facility in Bucks County, that she tried to contact local government in response to the poor care he received, that they make big money in these places and don't provide care, and they're always short-staffed, and it's hard to reach the corporate people for regulations. She thinks that senior care places need to be fixed, and the change needs to come from the top at the state level. So just really quick condolences on your father. I'm sorry about that. I want to tell you that as a social worker, I worked in a nursing home and we were not understaffed and we took excellent care of people. My mother's in a nursing home and she's being well cared for, but there are places that don't provide adequate care. If that happens, I would suggest you contact our area agency on aging. We do have an ombudsman there who will go out and take a look at any problems that you report that are in a nursing facility. And I would also say that one of the reasons that they are short-staffed, though, if you're finding that, is because there just aren't enough people going into that business. So if you're interested in healthcare, being a CNA or a nurse in a nursing home is always necessary. I'm going to shift to this question because I think my colleagues will probably have a lot of information on this. But the first part, and this is from Trisha Marie, she says the Bucks businesses are preparing to revolt and open without permission, that they're organizing and they have chosen a date. So I think there's 27,000 businesses in Bucks County. And, I know they're frustrated, but if there's a chosen revolt date, I think they probably would have contacted us. You're frustrated. You have every right to be frustrated at owning a business. This is a very difficult time. If we could just wave a magic wand and fix it, we would fix it. Instead, what we're going to do is to try to help you get ready to go into yellow so that you have no downtime. And that's what you should be focusing on right now, making sure that you're getting PPE for all of your staff, figuring out how you're going to keep people at least 6 foot away in your establishment. So there's things to do, things to get ready for. And we're going to start with some grant programs. So I'm going to shift it to Commissioner Harvey, who's been working on that, and let you know where we are.
Sure, thank you. As Commissioner DiGirolamo said earlier, this is a virus. There hasn't been anything like this globally in over 100 years. And so you're treating this as if it's the flu or something that's not as serious, is a mistake. We have taken money. We're taking money from the CARES Act that we were given by the federal government. We're dedicating, to begin, we're dedicating $6 million to small businesses here in Bucks County. And those are businesses whose revenues for yearly revenues are under $700,000, who have 49 employees or fewer. We are going to be putting up guidance about this grant program later today. We've had people working on it for well over a week now, trying to design this. This is not something the county's ever had to do before. It's the county system has never really provided for this, and so we're having to, in some ways, make it up as we're going along. So it's taken us a little longer than some of the other counties that had different systems and setups than we do. We hope to have the application up on our website tomorrow at some point during business hours. Businesses will have about a week to complete that application and submit it to the county for review. And then after review, we'll be giving out grant money up to $25,000. This is grants. These aren't loans. So this is not money that businesses will have to pay back. It's very likely that we're going to have to do more of these, but the good news is the system is set up, and so we will have that. And even people who are applying, if you're applying for one of these grants and you don't get one in the first round of funding, we're going to keep the applications on file, so you don't have to reapply if we go out for more money at some point in the future. We'll already have those applications. It'll just be the commissioners deciding how much more money to allocate, and then we can go to the applications that have come in and give out more without having to have people start the process all over again. We are also working through the Economic Recovery Task Force on specific guidance for businesses about best practices in terms of opening, sharing some guidance with you from different industries, providing connection or links to federal, state information, county information that could help you decide what steps you have to take as you're opening, a checklist to go through to decide how best to treat your interior space, if you have an interior space of your business, so that it's safe for you, for your employees, for your customers, for any visitors who come, depending on whatever business you have. And we are also working with the Chambers of Commerce and an organization called SCORE, which is going to provide free advice and counseling to businesses over the next or as long as this goes on, really. It doesn't matter if you're a member of any of the chambers or not. You can contact the Chambers of Commerce, and that information, again, we're going to try and have up all that guidance sometime before the end of this week. We'll have the information on our economic resources page, which is on the Bucks County website, buckscounty.org, and on the COVID portal. And if you take a look at that, you'll see different pages you can look at for that. So we're trying to roll all of that this week and get it, make it as helpful as we can make it.
Gene?
Yeah, and just to answer the question about opening up without getting permission from the state, or kind of like a revolt. If we could make the decisions here as county commissioners, I think things would be a little bit different. The governor declared a statewide emergency, which by state law gives him certain ability and authority to do things on his own part as governor. Now, I'm just going to speak for myself. I mean, if I was making the decisions for here in Bucks County, I would probably be allowing some of our businesses to open up with restrictions and precautions, more so than we're allowed to do right now. Last Monday, Governor Wolf, he had a press conference because there were some counties around the state who were threatening to go out on their own and allow businesses to open up. And the governor made it abundantly clear that if any county did that on their own, that there would be certain penalties that he would impose on those counties. And one of those penalties was that if the county commissioners voted to open up, that he was going to withhold vital and critical funding that the state passes on to the counties in a variety of different ways, that he would not give that to them. And also, and again, in a different life before I was an elected official, I was also a small business owner. So I feel your pain, and I can only imagine how you feel and how angry you are and how much you want to open up, not for only for your business, but for your employees as well. But what the governor also said, that if businesses opened up in counties that he did not give permission to go to the LFAs, that he was also going to go to the Department of Insurance, and these businesses would face the possibility of losing their insurance, and also that he would take away any state licenses that a business has that gives them permission to be open, that he would take those licenses away, and that he would use the state police to come in to enforce it. So I would just caution you, if you're thinking about opening up outside of the guidelines that the governor has set, that there are penalties that he he has said that he is going to use to any of those businesses. And again, I think we need to all work together to try to get to that yellow phase as quickly as we can. And I don't think Bucks County is that far away from that happening. So, let's continue to work together and practice all the safe things that we're doing. And I say this all the time, the health, the safety, and the welfare of the people who live in Bucks County are our number one concern, always.
Thank you. This question, here's the other side of, opening up before the governor says to. This is Diane Van Aken-Zielinski, and she says, what about the people that refuse to listen and abide by the guidelines? There are so many people not wearing masks and some large outdoor gatherings this past weekend with social gatherings, not social distancing, not being practiced. Yeah, I get concerned about that too. I was in a very long line at the food store yesterday and noticed how many people had 2 people with them when we've been trying to get people to go one at a time to the food store or to the pharmacy, whatever. So people are not listening to all of the guidelines, but everybody had a mask on. So that was good. And I think people need to keep that up. Sometimes when you pass people on the street, it may be that they're family. So they may be walking together or they may be at a gathering. And because they live together in a house, they're standing closer than 6 feet together. But it's very important. I know I would say about 40% of the mail I'm getting is from businesses or people who want this to go away. And the other 60% is people who are really nervous still. They don't want things to open up yet because they want to be assured that really things have cleared up and our numbers are better. So the best thing for the businesses is for us to keep the numbers low. So we have to keep using this equipment. And then when everybody opens up, everybody will feel confident to go back into those businesses again. Bob, follow up on that?
Yeah.
Gene?
Yeah, this is Gene. I mean, I was in a couple of stores over the weekend, and one was a supermarket, and I'm basically doing most of the shopping for our household. And when I walked in the supermarket, it was early in the morning. They had an employee there that was making sure that everybody that walked through the door had a mask on. And, he was being very nice. And I didn't notice anybody this week, but somebody tried to get in last week and he reminded the person. And the person just right away said, oh, I forgot. And, went back to his car and got a mask. So I was also in another store that they had a big sign on the door, no mask, no merchandise. So, I give our business community, the stores that are open, a lot of credit because I think they're really trying to do their best to make sure the people that come into their establishment are following the rules, especially when it comes to wearing masks and also social distancing as well.
Okay, I'm gonna, there's 3 questions that are coming up all about different dates. And so I'm gonna pass them out, but I will ask the first one. And that is, are elective procedures permitted, like colonoscopies, mammograms, and whatnot? Elective procedures in hospitals, starting with surgery right now, are permitted. My understanding is that very shortly they will start to do procedures like colonoscopies and mammograms. We do need to get cancer testing back on target too. The question that I will pass off to Gene and Bob are, when will we get our mail-in ballots? When are you going to start to receive them? And then there was one other thing and about parks and swim clubs. So I'm thinking, Bob, do you want to do the parks and swim clubs and camps, that thing? And Gene, you could answer on the ballots. Bob?
Sure. Yeah, we are. And in fact, I think there was a question about swim clubs and camps, and there was another question from Bill Sylvester, whose daughter works in daycare, and he was concerned about guidance. So basically for all 3, kind of lumping them together. Our health department is preparing guidelines for camps and daycares and swim clubs with sort of anticipating that obviously we're going to be moving to yellow at some point. And so anticipating that and being able to provide guidance for those. We don't have dates, obviously, for when swim clubs and camps get open. The swim clubs are essentially the biggest concern with the swim club is not so much people in the water, because the coronavirus does not do very well when it comes into contact with chlorine, which is a good thing. But it's more about when they're not in the water. in terms of laying around and just sort of, taking in the sun or doing whatever they're doing, making sure people are social distancing. That's the concern. Daycares and camps, we do want to provide guidance for them. We know that when people start going back to work, they're going to need daycares. They're going to need childcare, especially, schools are closed now, obviously, and coming toward the end of the school year anyway. So they would have needed those anyway. And the camps, we know a lot of municipalities do summer camps, and a lot of other businesses have summer camps. So we are providing guidance for them. I did know, before I throw it to Jane, I know there was a question about the mail-in ballots, but also if Jane wants to talk, I saw another question about procedures for poll workers, because there's somebody who wants, Elizabeth Oliver is going to be a poll worker and is concerned about what precautions we're taking to keep them safe.
Yeah, on voting, and again, we this is something that's sacred to all of us, to make sure that we have the opportunity to vote and our votes are counted. We are encouraging everyone to vote by mail if they can or if they want to. I think that's important. That would be important, that as many people as possible vote by mail. I think the Board of Elections, and Diane, help me out here a little bit. I think they're getting ready to mail the ballots out. I think
last week they started.
They started last week. So anybody that's requested a ballot should have them pretty quickly. As far as going to the polls safely and for our poll workers, I mean, we are doing a number of things to make sure that the locations where people will be voting and our poll workers and the voting are as safe as possible. We voted last week, the 3 commissioners voted that everyone that comes in to vote must have a mask on, a face mask on to come in to vote. And if you do not have one and you come in, and one will be provided for you to be able to vote. And if someone absolutely refuses to wear a mask to vote, I think what we've decided to do is that they're just going to have to wait till there's nobody in the poll to be able to go and vote. I mean, so I think that's how we're going to handle that. The polling places will be sanitized a day or two before everybody votes. They will also, after Election Day is over, be sanitized again after Election Day. There will be all kinds of protective equipment there, hand sanitizers, different pens if people want to use a different pen. We're trying to do everything we can to make it as safe as possible for people to vote, while still encouraging people to vote by mail, because that is certainly absolutely safe. So we think we've got things under control. We think we got, our poll workers are going to be protected, as well as our voters are going to have a safe place to come in and vote.
Thanks. So the next question we have, and I believe it's from Joy Greb, but if I got that wrong, it is either Mr. or Ms. Greb. There's several parts to this question, so I'm going to forget some of the parts, and you guys will answer those parts. Joy says she understands the federal government has promised to give money for contact tracing programs. Does Dr. Dansker have a plan in place for this? If so, how long will contact tracing programs for COVID-19 be in effect? How will you pay for this once the federal funds run out? Is there a written plan the public can read? Will they mandate testing for those who have had contact? Will you remove people from their homes to quarantine? What means will be used for tracing? I think there's one more. What means will be used for surveillance of those who are quarantined or isolated? So I'll start off with saying that Bucks County is the only county in Pennsylvania that is doing contact tracing. A lot of people started it. Bucks County has maintained it, and we thank Dr. Dansker and his staff for that. I believe he's got about 30 people there all day long and into the night doing contact tracing. There are some volunteers from our Medical Reserve Corps that are involved as well. We did get some money for this. We are not going to stop doing it. I haven't heard about federal money running out. This is about Department of Health money, I believe, that's been reimbursing this. And we're very proud of what has happened. We believe that this is one of the main reasons Bucks County is ready to move to yellow, is because we have a contact tracing system in place. And Bob, do you want to answer some other parts of that?
No, just I think you answered it pretty well. You know, as I said before, we're doing about 95% of the people who are coming in positive and getting positive test results. Our staff is reaching out to about 95% of them. The ones we're not getting to could be just people aren't calling back, or it's a bad phone number, bad contact information, so we can't get in touch with them. Even for people who are in long-term care facilities who may have health problems that make them nonverbal, we're contacting the staff and asking the staff, when did they first notice any symptoms, when did they first notice anything with that resident, and so using that information to build really the data profile that we have that, as you said, is better really, we believe, than anybody throughout the state. In terms of quarantining people, we did have through our emergency management agency, Mr. Forrester, Dr. Forrester, I just gave him an official title. But for Mr. Forrester, what he did over the course of the last 2 months was communicate with hotels and motels that would be willing to take, especially first responders and any healthcare personnel who were looking for places to go if they didn't want to go home because they were afraid they'd been exposed to somebody who had COVID. They didn't want to spread it with their families. We did offer that. I know Del Valle College was working with Doylestown Hospital for staff from that hospital that they could go and use some of the empty dorm rooms if they didn't want to go home. And what we found mostly was that a lot of people, even professionals and first responders, were comfortable going home. They had the ability to stay at home in a room that they could keep themselves away from their families. So, but that network is there if we need it for that eventuality. We're hoping that we have been through the worst of this. We're certainly hoping that as we do move to yellow, people are very conscious of everything they've been doing and keep doing it. The reason the numbers have been going in the right direction is because of all the hard work of the overwhelming majority of the people of this county who understand how serious this is and are making the sacrifices we have to make to protect all of us. And we have to keep that going. And if we do that, then we will have been through the worst of this, and we won't have to worry about spikes that would have to be dealt with later down the line.
Yeah, and again, Dr. Damsker, who's our head there at the health department, has just done an incredible job, and really amazing job from the very beginning when it comes to this contact tracing. He started out from the very beginning in identifying people, calling them up, and then going back and trying to find out which people they came in contact. And I've been over there a number of times at our Department of Health, and it is just so impressive to be there, to look at the number of people that are in a large room who are just absolutely every one of them on a call all day and every day. They have different shifts. So doing a terrific job over there, and I think that's why our numbers have been improving and getting so low, is because of that contact tracing and the great job that the doctor has done and his staff over the Department of Health. So congratulations to them. They've really done a terrific job.
They really have. They've really made us proud. Question from Nancy McCann. Nancy wanted to know how the mail-in absentee ballots are going to be counted. Will they be counted at the polls or at the Board of Election? Are they going to be counted manually or through machines? The mail-in ballots are going to be counted by a machine. I believe it's 2,000 ballots an hour they can count. I'm thinking we might have even gotten 2 machines now so we can go through it. There have been so many people that have applied for mail-in ballots. I think we're approaching 80,000 or so that we were worried if we started to count them at night after the polls closed, we wouldn't get them all counted. So we advocated, and the legislature did change that. We can start to count them by the machines when the polls open on June 2nd at 7 a.m. Anybody else want to comment that, or any other issue that you saw go past here that I missed?
Again, on the voting and a number of ballots, and Commissioner Marseglia said they've received 80,000. So we're actually expecting over 100,000. And in past years for the absentees weren't allowed to be opened till after the polls closed at 8 o'clock. But because of the large number that we've been receiving and because of the emergency and the COVID-19, the state legislature and the governor has given the Board of Elections permission to start counting those votes, the absentees and the mail-in ballots, at 7 o'clock in the morning. So they will be opening the ballots and counting them all day long. So hopefully by the time the polls close at 8 o'clock, that we will have a pretty good idea, if not a complete idea, of what those totals are. And they'll be able to be added to the people to vote in person.
Bob?
Yeah, I did see, I saw a question, I'm trying to find it now. There was a question from Buddha Khatri from Middletown about the information we post on our website. The information that is posted, I think it's every night, public information works with the health department to put up information, the most recent statistics. Again, on our buckscounty.org, on the COVID page, there is a lot of data that's available for people to look at if they scroll down and take a look at the different charts and graphs that really track a lot of what we're learning about this virus and how it's affected the county. And that's kept up every day. So I'm a little confused about the question about seeing the news not being published daily, but we are posting numbers daily. And the numbers, the follow-up to that question was, are the numbers reflective of what's happening in nursing homes? Yes, we're not segregating that data. All the data that comes in, all the cases that we get reported or get reported to us are reported on a daily basis. It doesn't matter where they come from.
I am just seeing, I thought we were on our last question, but we just got one more. It's from Amy Brown of Warrington. We haven't answered the question as to why our community cases are being lumped in with nursing home, long-term care facilities. Shouldn't they be separate since we know where the nursing home numbers are coming from? So I'm sorry if you didn't hear us answer that, but we've been answering that for weeks. We were the original county in Pennsylvania who wrote to the governor to say that we thought that the lumping together of those numbers might prohibit us from opening when we were really healthy enough to open. So we have been constantly working, to try to get some attention made to those metrics. We did not lump them together. That comes from the state, and we're a Commonwealth, so we need to. The state tells us how to do it, and we kind of have to just follow that. There was another question in there today, but I'll answer real quick about how many staff we have that have tested positive for COVID, and they also want to know how many rangers. We have had approximately 86 staff members. Most of that would be in the nursing home. Some may have been jail. There's a smattering in other places, but I can't, for HIPAA reasons, I probably don't even know how many people specific there are to the rangers. And before passing this off, we are almost at the end of our time, and actually I don't see any other questions. So before I pass it off to anything my colleagues want to say, I want to wish you all well. Like when we come back to do this again, I guess in 2 weeks, I am hoping that we will be out by then. But I am asking for a big, deep breath. Patience, patience, patience. We will get there, and we are going to put every effort out once we get there to making sure that the Bucks County businesses are being patronized by Bucks County residents. We're going to get people into Bucks County, and we will revitalize things. Bob, last questions or comments?
No, thank you. Thank you for those people sending questions. We did our best to answer them. A lot of times we're combining questions because a lot of the questions are the same. So if you didn't necessarily hear your name, you may have heard the question. I know I was told that despite the fact that I'm actually hardwired here to the county network, that I did cut out at some point earlier on about hospital beds and my answer about hospital beds, so I apologize for that. We're working on doing what we can do regarding the IT system and our capabilities here in the county. So we do look at hospital bed information, and we do take a look at how many beds are available. The bed availability has been good. It's hovering around 50%. Sometimes it's 40% available. That's ICU beds and regular beds. Our ventilator availability has always been pretty good. It's always been at about 70% or 80%, something like that. It's actually higher now. And our absenteeism among our hospital staff has really dropped a lot over the last couple of weeks. That's obviously a key factor. It almost doesn't matter how many surgical beds and hospital beds and ICU beds and ventilators you have if you don't have nurses there and doctors there to take care of the people. So we're watching those numbers too, and they've been moving in the right direction. So I want to thank everybody. And just, I did see a couple of comments I was made aware of about last week. Last Monday, we did a town hall like we did before, but that was specifically geared toward students, K through 12. And I was hearing that there were some people angry that we weren't answering their questions, but they weren't students. So it's why we dedicated that town hall to them. Likewise, on Thursdays, we do press conferences. We're answering questions from the media. And I know there are some people, thinking we were ignoring them because they were sending questions in apparently, and we weren't answering them, but we were answering questions for the media because it was a press conference with the media, not because we were ignoring anybody. We've set aside these times for town halls like this one. Next Monday, of course, being Memorial Day, we won't be having a town hall that day. And as Commissioner Marseglia said, we all hope that by the time we move into the next Monday, that we're having a different conversation. So thank you, everybody. Please stay safe. Please keep following all the guidelines, and you can help all of us move to the next phase.
Yep. And thank you all for joining us today. Thanks for the questions. I mean, they were terrific questions. They really were. We thought about doing this, and we've been doing this, I think, every other week, and it's really, really worked out really, really well. We're trying to be as open and as responsive as we can possibly be. And I really think we've done a reasonable job of doing that here in Bucks County. And again, just keep up the good work. I mean, that's the only message I have. I want to get there to yellow as quick as we possibly can. And the way we do that is to just keep doing what we've been doing and, respect the guidelines and the rules that are out there. Stay home if you don't have to go out, wear a mask, social distancing, and we're going to get there. And again, I keep saying this all the time, but we're going to get there, and we're going to get there together because Bucks County is a really, really special place with great people in it. So God bless you. And again, keep up the good work. Thanks.
See you June 1st. Thanks, everybody.
So long.